Hi everyone, welcome back. So today I am going to do a bit more of a general video, and I'm going to be talking about how our expectations of a massage treatment don't always match up to the reality, and why this may be. As a therapist myself, I've heard from a lot of clients who have said they've had treatments that haven't been particularly positive, to the point that, they're quite nervous of having a massage again. And the reasons for these less than positive reviews varies from the therapist not giving the full time, or it felt like that they couldn't be bothered to do the treatment, they didn't really want to put any effort into it, or sometimes just that the client came out of the treatment feeling like they'd not actually had anything done. And certainly myself, having had certainly a lot of sort of spa type or gym based Swedish massages, I've certainly felt like that. I come out and it's like within sort of 10 minutes I just feel back to normal in terms of sort of stress and muscle aches and things. So there seems to be a lot of confusion with clients about certainly the difference between a Swedish deep tissue and sports massage. That's probably one of the most common questions that I get asked. And I did actually do a video on the difference. And unfortunately, explanations of this by unqualified staff in some places offering massage really doesn't help matters and doesn't help to resolve this confusion. Sometimes clients have every reason to be upset about their experience. For example, if you go in wanting a relaxing Swedish massage and, you're doing your best to relax, and then the therapist doesn't stop talking about what they were doing at the weekend or, whatever. But sometimes it can be due to maybe the client's expectation is too high. And that's more the case probably with new clients who've never had a massage before. So they've really sort of don't know what to expect. But, part of my job as a therapist, is to answer questions that the client may have and explain to them what they should expect from the treatment, and also what they should expect, afterwards when they've gone home, so that there's not any surprises. So basically, how do you avoid going for a treatment, expecting to come out feeling like a brand new person, but instead you come out and your hair's all clumped together with blobs of lotion, that's kind of clumped your hair into this greasy mess. And your face, you end up with like the scuba diving, marks, where your face, it's sort of been sort of under pressure in the face cradle. So how do you avoid, these experiences? How do you know if, as a client, your expectations of your treatment are too high? So the basic answer, you can ask your therapist as many questions as you like, and if they're good at what they do, they're not going to have any issue answering your questions. So probably the biggest issue surrounds pain levels. A lot of people, I see this quite a lot with people who book in for a sports massage for the first time. They think that just because it has the word massage in there, that it's still going to be this relaxing, treatment. Well, of course, sports massage is not going to be a relaxing treatment. If you want pure relaxation, then you want to pick a Swedish massage. and then your expectations will be met. But trigger point therapy or sports massage, it can really be quite uncomfortable. And that's because it's getting really deep into those muscles and areas where there is a lot of muscle tension, and it's really breaking down those knots, and addressing areas, possibly of scar tissue as well. So, yeah, it's not going to be relaxing. Some people will think, well, if I go for a massage, it will get rid of all of my pain. Well, this can be unrealistic. Sometimes clients will still have some pain after their treatment, and this can be for various reasons. Therapists do vary a lot in terms of their knowledge and skill, and it is possible that maybe they haven't got the experience to deal with your particular issue. Maybe they've not actually done a treatment that was appropriate, or they could have bad technique. Certainly with a sports massage, I always inform my clients that, it can be uncomfortable while the treatment is actually being carried out. And that again is because you're working really deep into high areas of muscle tension and really breaking that down. But also I warn my clients, as should any therapist, that it is normal that following a sports massage, when you wake up the next day, you can feel a bit achy, kind of like you've overdone it at the gym. And so the client should be informed of this so that they know what to expect. But also in terms of pain, it depends on, what the issue is and how long you've had it. And even with tight muscles, if they've been super tight for, 6 months or a year, that's not going to go away in just one massage session, because there is sort of such thing as muscle memory. And, as good as your therapist may be, it's just not, it's going to take time. It took time to build up. It's going to take time to break it all down. And there are some things like a long-term medical issue, that more than likely will never be resolved. It may be helped in the short term by massage, but it may never be resolved. And certainly I've had a few patients who have spondylitis in their spine, and a couple of clients who had they basically had spinal fusion surgeries, one of whom, it was repeated 4 times and really botched. No amount of massage, was going to turn that situation around. But if for that client the massage offered some relaxation in the short term, then great. But, it's important that that client is aware that, massage is not going to be this miracle cure, and it's not going to suddenly reverse something like that. If you've had a moderate muscle strain at the gym, but maybe not given it enough time to heal, before having a treatment. So if there's still inflammation going on, your therapist should discuss that with you anyway, but, it wouldn't really be appropriate to have a treatment during the inflammatory phase. If you have a massage treatment at the wrong time, so for example, if you've gone out on Sunday afternoon and done a triathlon, and then you go in for a full-on sports massage, at the Monday lunchtime, boy, that's going to hurt, and you are going to really feel it. And again, it would be more appropriate to, in a situation like that, to have maybe a Swedish or a sports post-event massage, just to cool the muscles down, calm everything down. And then maybe, 48 hours later, have your general maintenance sports massage to really break down those areas of tension. And also just, stubborn issues. So things like a frozen shoulder, I will be doing a video on frozen shoulder. That can, last for usually around 2 years before it can get resolved. And if that's not responded to physiotherapy, and it's been there for like a year already and you're in that real frozen stage, it's not going to be fixed in one massage session. You are going to need a course of treatment. And again, that where everything's locked down so much, that is going to be quite painful, to resolve. So it's just about informing the client and making sure that they're aware of these things. Now, there are some things to consider when, setting expectations for your treatment. So I'm going to go through these now. So the first of these considerations, which we just touched on briefly, is duration of the pain or issue that's causing the pain. And as I've said, chronic conditions are going to be a lot harder to resolve and going to take more treatments. But also pain intensity. So again, severe pain, it's going to be much harder to ease, because aside from whatever the actual cause of the pain is, the client's tolerance level is going to be much lower. So again, it could be a case of, maybe starting with a deep tissue rather than a sports, potentially because the client may not be able to tolerate the discomfort level. Also, it's important to consider these additional medical issues that can't be fixed with massage. So for example, there might be something, maybe kidney stones. Now, if you have kidney stones, it's really painful. And, you can feel this in the muscles around the back. But that kind of associated pain is not going to be relieved with massage until the cause, i.e. the kidney stones, are resolved. Stress level, because stress, we know, impacts on muscle tension and also on the muscle's resistance to release tension, so how effective the massage is going to be. Certain types of massage are certainly more conducive to stress, whereas others may have the potential to induce further stress, and therefore they're going to be ineffective. So if stress is a major factor, again, something like a Swedish, potentially a deep tissue would be, more appropriate to try and deal with the stress, and then you can gradually build up, to a firmer massage to, work on areas of sort of more severe tension. And personality of the client as well. If you're like me, a natural worrier, people pleaser, we tend to have quite often low self-esteem, and we have trouble switching our mind off and trouble relaxing. So not only is tension relief going to be more difficult, but it's also going to return more quickly. So again, one massage is not going to make a huge difference. And so it's important to kind of think of it as more of a healthcare plan rather than, a one-off treatment that's going to fix everything, because that actually is going to be quite unrealistic. Another consideration to take into account is the therapist. As I say time and time again, finding a therapist who is experienced, qualified, has a strong knowledge base is always important. If you say are a diabetic with a frozen shoulder that's compressing a nerve, being treated by someone who is Swedish trained only, who worked in a hotel spa for 6 months, is not going to do anything. You need to make sure that you are seeing a therapist who, is more sports trained, who is experienced in dealing not only with frozen shoulders, but also who is familiar with the needs of a diabetic client. And again, I have done a video on the diabetic client, which you can watch now. I will also in the future be doing one actually on frozen shoulders. So it's just making sure that you maybe do a little bit of research, and again, ask the therapist questions before you book. They're not going to mind, if they're any good at their job. Time. Plan ahead and arrive for the treatment with 10 minutes to spare, because then you're not going to arrive feeling overly stressed, and feeling like this sort of sweaty mess, worrying about whether or not you're going to get a parking ticket because you had no time to look for a proper space. This is important if you're going somewhere as well, if it's your first massage and you're going to need to fill out a consultation form. You don't want to spend 15 minutes of your massage time filling out a form. So, just make sure you allow plenty of time, and that way you'll be more relaxed, and hopefully the massage again will be more effective. Another thing, if this is something, certainly a lot of clients worry about this. If you are someone who worries about, what the therapist will think of your personal hygiene or your clothing, which we really don't care. But, if this is something that you worry about, I've had a lot of clients that will come in and they'll apologise because they didn't shave their legs, or they're wearing their big Bridget Jones knickers. We don't care. I'm really not bothered, and no other good therapist is going to care what underwear you have on, or so. But like I say, if it's that much of an issue for you that you'll be stressing out on the massage table, thinking that you look like Bridget Jones or a woolly mammoth, then again, just take a little bit of time and plan ahead, although it's really not a problem. If you're stressing out about a, tiny little spot of cellulite on the back of your thigh, or that your stomach is bloated out because of your IBS and you're looking like 6 months pregnant, or maybe you just sort of sit through the massage, constantly in need of the world's biggest fart, just stop panicking. We've seen it all, smelt it all, and heard these things many times before. So you're really no different to other members of the general public that come in, and, we don't remember specifics about your bodies either. So, yeah. But, communication, sort of about everything, and during the treatment, if the pressure isn't right, if you find the music really annoying, or, you're so cold, you're starting to feel like a polar bear, tell the therapist, and, so that the issue can be fixed, and, you can get on and enjoy your massage. And then hopefully, your expectations will actually match the reality. So, yeah, those are the main reasons why You know, you may be sort of disappointed, but as I say, if you do a bit of research in advance, find a good therapist who is qualified and has lots of experience, particularly with whatever your particular issue is, you know, then this shouldn't happen, and you hopefully will come away, you know, feeling like you've had a good treatment, and want to go back. So that's it from me today. As always, feel free to comment, contact me through Instagram or Facebook, and I will answer any questions. And also feel free to subscribe to my channel, because there will be more videos coming your way. But for now, that is all from me. So I will see you next time. Bye.